Hello and welcome to this West Midlands School of Clinical Hypnotherapy revision video. In this video we're going to look at using natural phenomena in induction. So this is the use of various different natural occurring incidental phenomena within inductions. So the first one, and possibly the easiest, is breath. Often forgotten is breath. And it's a really simple little secondary suggestion you can make. So as the person is exhaling, their whole body is relaxing just very slightly. And by combining relaxation, deepening suggestions with that physical action, you're effectively making a physical suggestion along with the auditory suggestion. So you're saying, relax. And as they're breathing out, their body appears to be relaxing, and it doubles up the effect of that suggestion. So delivering deepening suggestions on the out breath, and that's true for both inductions and deepeners. Tiring, very commonly used, particularly in more traditional hypnosis, but still used within Ericksonian permissive models of hypnosis. Tiring is particularly common when doing eye-based inductions, so fixation of the eyes. And as the person fixes the eyes, a number of different levels of tiring occur. There's the muscles at the sides of the eyes that control roll. They will tire if you're doing any sort of upwards visualization. If there's even a slight upwards, they're going to begin to tire, so that the eyes are going to feel heavy and tired. You can often spot this, of course, when people start to blink. There's also the tiring, the more sort of subtle tiring of the cornea itself, as the lens within the eye attempts to focus, if focused on a single point, because actually our eyes are constantly moving. There are constantly tiny little vibrations going on that prevent over-tiring of the neurons at the back of the eyes. And if you remain focused on a particular spot, deliberately focused on a particular spot, those will tire, and what will happen is the image will change. Probably it will blur. And if you tell a patient that their eyes are going to become tired, that they're going to blur, they may even experience different colours, which is a common phenomenon associated with the tiring of the neurons at the eye, then what actually happens is, what's happening naturally as part of the process of focusing, you're getting credit for, if you like. So it's adding to the weight of your authority and your suggestion. And you can be completely explicit about this and it still works quite happily, because it just shows knowledge. Although it is more effective, obviously, if you're just saying, this will happen, and then it does. This will happen, and then it does. But all you're doing is pointing out phenomena that's going to happen. You're not even necessarily taking credit for it. In fact, I'd advise against taking credit for it. I'd just say, this is likely to happen. This is the next thing that's going to happen. Okay, IMR, ideomotor responses. These are small unconscious movements that we all make. The common example of this that many people seem to know is the tell in poker, the little sign that gives away that somebody's excited about something. But we all have tiny little movements that we make all the time that we're not even conscious of. Some of them are quite grand, some of them are quite small, but ideomotor responses are quite small, and these are used in certain forms of induction. So for example, the hand levitation induction. The hand naturally rises on every breath, naturally rises a tiny little bit, and little suggestions for rising will just enhance that. So you get the effect of breath and the effect of the ideomotor response, because if a person's thinking about their hand rising, their hand will rise a little bit. Now, it takes a conscious move or a deliberate action to move it a lot, but just to move a little bit. And then you can build on that little instinctive response. If you then essentially, again, take credit for it, but again, don't claim to be doing it, just observing it, just pointing it out, you can take the hand and you can float it up and up and up. And we'll see that later in hand levitations. Dissociation. Dissociation is the act of, for what we're concerned with psychologically, stepping out of oneself. So the most common form of dissociation is to imagine stepping or floating out of your body. But you can also dissociate parts of the body, so you might imagine floating off an arm or something like that. Simply including within an induction words such as drifting, floating, can help encourage dissociation. And dissociation is heavily associated with hypnosis. So generally it is argued that the more dissociation there is, the deeper the hypnotic state. Fractionation. Fractionation is an interesting phenomenon. It's been observed that every time somebody, particularly in trance, opens and closes their eyes, each time they close their eyes, they go a little deeper than before, as long as the time gap between is not too much, but particularly true if they're in hypnosis. So, getting a person to open and close their eyes, open and close their eyes, open and close their eyes, each time going deeper than before, will actually have the effect of taking them deeper and deeper and deeper. And the final one on the list is confusion. Now, this isn't one that we necessarily use a lot as therapists. I personally don't use it very much as a therapist at all, because I work heavily with anxiety patients and it's completely inappropriate. However, in some situations, maybe with smokers, particularly if you've vetted them, it could be appropriate. However, I prefer not to do it. But the essence of confusion is you throw out a whole load of ideas, usually conflicting, there's too much going on in the human mind, and then you throw out a single clear suggestion. And that single clear suggestion the mind grabs hold of and goes with. So you might go, okay, I want you to go left, right, up, down, sideways, now close your eyes. And it's the close your eyes that comes forward. Nice, clear suggestion. Because the mind's in a state of confusion, it will just grab hold of the clearest suggestion it gets. So that's the basis of confusion technique. But like I said, because I work an awful lot with anxiety and very personal conditions, I tend not to use it because it can be a bit aggressive. It can be a bit unsettling. Working with someone with panic attack, wouldn't recommend using confusion technique. Okay, so there we have it. Natural phenomena that we might use inductions, and indeed we might use them at other points in therapy, but we're talking about inductions. About breathing, so and relax. Tiring at the eyes most commonly, so the eyes are tiring, the focus of the eyes is tiring. Ideomotor responses, small unconscious movements that we can then exploit by exaggerating them, basically by pointing them out and bringing them to the attention of the person, gets a stronger effect. Dissociation, by including suggestions for drifting, floating, we're likely to encourage dissociation. And of course some inductions are strongly dissociation based. Fractionation, eyes open, eyes close. Eyes open, eyes closed. And each time you repeat it, the person goes a little deeper than before. And confusion. Very strong, very powerful to be fair. Lots of confusing different ideas and then a single clear suggestion that you want them to act upon. Okay, thank you very much.